Well, good afternoon and welcome to MedTech Crossroads. I'm Gene Paranek. Today's episode 98. Hard to believe we've been doing this just nearly 100 times. It all started out with COVID, and now that we really hope that that is coming to an end here in the US and in Michigan, we'll just be tracking probably these last 2 weeks, episodes 98 and 99 in the death and hospitalization data as that drops down. But our goals today, we're going to give you that last bit of COVID news, and then our new series, Early Stage Funding. We're going to be talking about all things funding, and we'll be starting out today with our friend Denise Graves from the MEDC. She's the University Relations Director. She's going to be outlining not only translational programs that are run through the universities in the state of Michigan, but also giving us an overview to the world of early stage funding and some of the things that the Michigan Economic Development Corporation provides that go through the life cycle of young companies. After that, it'll be time for Q&A, and we'll take your questions and events as always. But first, COVID metrics and vaccine distribution, all from healthdata.gov. This is data from the CDC, and we're tracking just a small amount now. Probably one of the most important numbers is that positivity rate. Positivity rate now having dropped well down below the 10% mark, looking like about 3% at the moment. New deaths, thankfully dropping, although they got relatively high even during this last wave, and we're looking there at the 7-day average. Not the data spikes. Data collection has become a little bit more sporadic. But now those deaths dropping down, really great news for the state of Michigan, this Michigan data. And in terms of hospitalizations way down as low as the trough last summer. We hope that that's a longer duration. Some reasons to think that that may in fact last. So that's what we're hoping. And here, a relatively new graphic. Kudos to the CDC for still putting out new graphics, new ways to look at the data. The community levels by county of COVID-19. State of Michigan looking awfully good, with the exception of a few counties in the northern part of the Lower Peninsula. The national picture compared to the winter 20 to 21 peak, looking at hospitalizations, cases, and deaths, and thankfully all dropped down well below that 50% of their 20 to 21 peak value, dropping down quite nicely. So we're very thankful for that. The last hospital system to be tracking COVID numbers, University of Michigan, with 12 hospitalized with COVID, only 1 on a ventilator. So we are thankful to see that kind of news coming out statewide. And next week, we expect will be the last week we'll be tracking the COVID numbers as they have dropped and continue to drop. Hopefully stay down for the summer. Hopefully stay down for good. That's really the hope. We'll see what happens. With that, just a bit of news that you have heard locally. MHeal is inviting you to the External Design Review. If you're at all involved in this ecosystem, April 9th, 10 a.m., they are still looking for attendees at Rackham Graduate School for their External Design Review for many of their projects that they are running, working with developing nations, and they're really putting students directly on projects that affect people. So we're always excited about what they've done, and you can get involved through their External Design Review. Come and see what they've been doing. April 9th, 10 a.m. at Rackham. Well, that brings us to our main event. It's time for another series. We had a series on early stage education, higher education. How do people get into the medtech industry? After that, we talked about a long neglected topic, and one that I think all of our panelists agreed you can never do too much of, and that's customer discovery. Do you really understand your market? Do you really understand your customers? And usually the answer is no. Let's do more customer discovery. So we really enjoyed that series. After a week in between where we talked about the FDA updates on their guidance documents, it's time to start this new series. And that is early stage funding. It's the question that every startup, every entrepreneur has. How do I get funding for this great idea that I have? So we'll be doing this from March 25th through April 29th. There'll be 1 week in the middle there that we will focus on a slightly different topic. But in general, from March 25th through April 29th, we're going to be talking about early stage funding. And It's challenging because way back in the day, oh, you might go to friends and family to get started. You might have to sort of scrap around the edges. Fortunately, there are options, and many of those options these days in the state of Michigan are supported by the state of Michigan. So we thought it would make a lot of sense to invite somebody who knows all about how this works on the inside. And that is our friend Denise Graves, who's the University Relations Director from MEDC. Denise, welcome back to MedTech Crossroads.
Hi, Gene. Great to be back. Thank you for having me.
It's always great to see you. And thank you for being willing to kick off not only this about what MEDC does and continues to do, but also this whole series, which is, I think, really important in the lives of new product development teams.
I couldn't agree more. So happy to be the inaugural, speaker, if you will, on this topic and kick it off. I look forward to hearing all of your other speakers on this topic throughout the next 6 weeks or so.
Yeah, we're looking forward to it. Well, and actually, before we dive into our topic, you have also agreed last November to be an advisor to MedTech Crossroads. We've greatly appreciated all your input, all your thoughts. And you and I are both loving the series format and talking about series and topics that go not just for an hour, but over multiple weeks. There's something in the works here that you've been putting together for us. Why don't you tell us just a little bit about it before we dive into early stage funding?
Sure, I'd be happy to. I really appreciate you humoring me on the idea I had to create a series of women who innovate. So I'm really excited to work with you to kick off this series that will start on May 20th. And the thought process would be to collect women who are doing incredible work around the state of Michigan as it relates to innovation. So we're going to start in the university setting with some faculty members, as well as hospital clinicians, for them to talk a little bit about the way that they innovate, why have they chosen to innovate their technologies, what that really means, and are they, coming at it from a teaching perspective, and are they providing any experiential learning to students? And then from there, we'll transition to the teams that support these clinicians and faculty members inside their own institutions. So we'll talk to some folks in the tech transfer offices, both at universities and hospital systems. And then we'll transition to mentors and residents. We'll talk to a couple of mentors that help these faculty members and clinicians get their technology a little bit closer to the market through working on milestones and introducing them to industry partners and venture capital professionals. And then we'll round out the series in August and talking to a couple of women CEOs in innovative and small companies in Michigan and get their perspective on what it's like to take a startup out of a university, build a small company here in Michigan in the tech space, and what motivates them to do so, and some of the learnings that they have received along the way.
Well, it's going to be really fun, Denise. I appreciate your leadership in putting that together. And as you described, it's going to be sort of a series between series, right? So we'll go for a handful of weeks on a topic, and then we'll pop back into the Women Who Innovate series, and then we'll go back to the topic, and then we'll pop in again. So you're going to hear from that series all throughout the spring and summer, and I appreciate your leadership in putting that together. Well, back to the topic at hand. Everybody wants to know, how do I get funding for my phenomenal idea? And it's of course, we have realized in recent weeks, well, you got to see if it's a phenomenal idea. First of all, it's where customer discovery comes in. And you've always been a strong advocate for that in any setting I've ever seen you operate in where funding is on the table. But now somebody says, where can I go? What can I get? We thought it would be good to start out talking about the offerings that the Michigan Economic Development Corporation has. We're going to put up what you guys call the subway map here in just a second, but maybe even before that, can you give us just an overview so that anyone who's not familiar with MEDC can understand what it is as we come into these options?
Sure, I'd be happy to. So the MEDC, the Michigan Economic Development Corporation, is a public-private partnership in collaboration with hundreds of economic development organizations across the state of Michigan. And we're really focused on making Michigan the place to do business and assist businesses in their growth, as well as build communities and create talent to support those businesses and the people that work at that business. We have 6 strategic focus areas, those being attract, retain, and grow businesses, support talent, develop attractive places, accelerate high-tech innovation, market the state, and support small business. And those 6 strategic focus areas that have teams wrapped around and involved in those areas will support 4 key guiding principles that the MEDC wakes up every day ready to tackle, and that being sustained long-term growth in our state, a regional impact, equitable high wage growth, and customer focus. And for anyone who's interested in learning more about the programs that we support and the Entrepreneurship and Innovation team that the programs we're going to talk a little bit about today fall under, they can visit michiganbusiness.org.
michiganbusiness.org. That's great. And of course, many things. I think a lot of people are familiar with the Pure Michigan campaign that you've seen all over TV for many years now, and that's an MEDC effort, as I recall.
That's correct. Yes.
Many things like that. Well, let's talk a little bit about funding options. Like we said back in the day, sort of the only option for you and your startup were go find some friends and family to keep the thing moving until you could find some angels to scrap together enough and hope you kept enough control over your idea to eventually make it to some venture capital funding, which even then was mostly coastal. That ecosystem has really matured largely with a lot of support from MEDC. I think we're going to bring up the subway map here. To let you tell us a little bit about how the organization has thought about supporting new ventures all the way through the process.
Sure. We're very fortunate to the legislature and to the Michigan Strategic Fund Board and supporting the approximately $16 million in funding that comes to the Entrepreneurship and Innovation team on an annual basis. And it has kind of a 3-legged stool approach, if you will. So about 1/3 of that funding goes to university programs. About 1/3 of that funding goes to service providers that are wraparound services to startups and small businesses who are, trying to raise money and trying to get support for their companies. And then 1/3 of it is very early stage funding. And as the subway map demonstrates here is, we have a lot of 3 key programs in the university space that are laser focused on commercial milestones and providing some matching funds for those projects to work on those milestones to get to the commercial market. And going back to what you talked a little bit about earlier is customer discovery. So we also, in addition to some early stage funding, we get them connected with a mentor, and we make sure that they're also adding the customer discovery process to their scientific milestones, if you will, to increase the opportunity for them to either create a startup or license to an industry professional, their company here in Michigan. From there, we support 21 smart zones across the state of Michigan who are there to provide a concierge of services to these startups and to anyone who is interested in starting a company. Visit your local smart zone. They have mentors. They have a lot of programs and resources available to you. That's where you tap into a lot of the MEDC programs that you see here. When we look at SBDC team members that they can engage with, we have some support for SBIR, STTR submissions and training. Those are big federal programs that companies can tap into that provide funding for commercial milestones as well. We also have matching money for the applications for the Small Business Innovation Research Grant and the Tech Transfer Research Grants as well. And that is through the Smart Zones. We support Business Accelerator funding, which is a little pot of money that companies can tap into to help support things such as intellectual property review, if they need some more work there, additional money for proof of concept, maybe some attorneys support, website design, things of that nature that not a lot of other grant programs might support because they are focused on commercial milestones. And then we have 2 key capital programs. So we have the First Capital Fund, which is kind of the first money in that is available. That's through Invest Detroit. And all of the eligibility and requirements and such and applications can be found on that website, or also linked to the website through the Entrepreneurial and Innovation ecosystem website through the michiganbusiness.org. And then we have the pre-seed fund, which follows along the first capital fund and provides tranched money to small companies that are, again, trying to get into the capital market, get things done until they can attract a venture capital professional, or until they can get some, customer funding in the door and then continue their growth from there. Now, one of the things through the Entrepreneurship and Innovation program is these are all high-tech companies, intellectual property type of companies. The small businesses that we have that don't necessarily make use of intellectual property can access some support and funding through other MEDC programs that are also spelled out on our website at michiganbusiness.org as well.
It's a really fun view of everything that MEDC provides. Of course, we'll give a little closer view here from the university entry station for translational ideas, all the way through the things you've just described here. And I have to say, Denise, like over the years, I remember I've been in this business for, I guess it's been 22 years, and into being here for the past 11. It was always a question, where is funding going to come from? And I feel like now you actually are always pretty close to it, no matter where you are. You just have to know where to look. And I think a lot of that is thanks to these kinds of programs that MEDC has been offering. In later weeks, we'll be talking about other things. You mentioned the BAF funding. We'll be talking about angel and VC funding and conglomerations of those types of investors. Let's go back all the way to the beginning, and this is where your work is with translational research. We go all the way back to the left on this subway map, and I think sometimes we've actually encountered university researchers who are, very, very driven. Well, sometimes they're driven in one of two ways. Some are driven, and I know you'll relate. Some are driven just to find more funding for their research, and some of them. Right. Are driven to get out there and see their idea realized, and they just want to get out there as fast as they can. I know I've seen a couple of instances where we have to almost tell them, wait, hold on, don't exit the university too quickly. You haven't actually taken advantage of the de-risking that you could do within that context in translational funding. There's some really good de-risking that you could do. And then, of course, they're the ones who really just want more research dollars. And that's not really the focus of what we're talking about here, right? Let's just clear that one up front.
That's right. You're absolutely correct, Gene. Hit the nail right on the head. The programs that we support through the Entrepreneurship and Innovation team are focused on translating that research into the commercial market. So very early stage, there are federal programs that support basic research, research for research's sake. And then, what do you do from there? So there was a huge gap a number of years ago. The university programs have been put in place since about 2012. And so they provide a way for projects who have found that they have some commercial merit, get some matching funds and get some support through mentors and through those university services that a lot of the universities provide to get their technology out into the commercial market. So it provides matching funds for scientific milestones. The mentors provide kind of the business match to help them validate the market, help them to validate the technology, get them introduced to industry for customer discovery purposes, or even for an opportunity to do a license, or get them ready to stand up a startup and help them to find talent before they pull the trigger, if you will, and do the startup. And they are coached significantly to be a little methodical in this process, just to make sure, as you mentioned, not to start too early and get out there too early, because it makes it impossible to come back in to make access to the university programs. And we talk a little bit about when we're working with faculty to make sure that you take advantage of all of the non-dilutive funding that you can before you do your startup. And non-dilutive is just the fact that this is funding available that does not take any ownership in your intellectual property or any ownership in a startup that you might create afterwards. So take advantage of it as much as possible to be able to continue on with your work, just to make sure that once you get out into the commercial market, you can kind of hit the ground running and continue on from there.
Yeah, it's a really phenomenal resource, and I think it's important for researchers to know that these kinds of things are available. The ones who come asking for more funding, I think the university programs have actually been very successful over time in training people. Wait, hold on,
Yeah,
this is you got to really have an intention to move this thing forward and move it out with some kind of creation.
absolutely.
And of course, that aligns with the intentions of the various tech transfer departments at the universities. Although often in my own mind, and I'll say this for how I've seen it, and you can correct me as wrong. It was a few years ago that I realized, oh, okay, this Bayh-Dole Act that was passed in, I think it was 1980, really led to the creation of university tech transfer departments. But it didn't necessarily give them a reason for being other than to make publicly funded research available to the public. It was sort of like, okay, and now what beyond there? And they've had to fight and scrap and try to understand, how do we take that mandate and then do something with it and really turn this into a pipeline to get ideas out, because it's good for everybody if these things get licensed and get used. It feels like a lot of what MEDC has done, especially in the translational research aspects, has helped to further that pipeline, or give reason to that pipeline, give motivation to it. How do you think about that, between the inherent motivations of a tech transfer department and what you can bring to further that?
Yeah, great points, Gene. It's important to have a lot of tools in your toolkit, if you will, to be able to support this type of work across the universities. We don't do any of the heavy lifting. I look at the funding, and I look at my relationship with the universities and being a partner, and just providing them with a set of tools to be able to support their faculty members who are interested in commercializing technology. They have a lot of teams in place. They do a lot of the heavy lifting in working with faculty, and engaging with them and convincing them that they have something, that they have teams available to help, and you're kind of moving forward down that pathway. So it's not for the faint of heart. It's definitely not a huge revenue driver, but it's a very needed process and a really cool opportunity for a university to help a faculty member in getting technologies out to market. We're just a tool and a pathway for them to be able to do that. The universities make great partners. I have the pleasure of working with all 15 publics across the state, large, small, it doesn't matter. And what's really cool is that the larger institutions also mentor the smaller institutions and provide resources and provide, best practices. We have quarterly roundtables where we discuss a lot of different things, so that there's always experiential learning to the smaller institutions as well. If they have a couple of faculty that are interested in doing something, and they don't have the bandwidth of a huge team behind them like some of the bigger institutions do. So it's a great, statewide university collaborative network that we have. And I just, see these programs as being kind of a cog in, or a puzzle piece, I guess, if you will, in a bigger puzzle of, working with faculty and getting products out to the market.
It's actually really encouraging to hear you say that, because I think 20 years ago, when I first became exposed to these kind of what was going on in the state, I feel like there was a lot of everybody who came to the table felt like they had to be the be all and end all of everything. And to hear you say, hey, we know our place, we know how we can help, we're going to do that, and it's not the entire story, just shows the richness of the ecosystem and the matrix that has been developed here, which I think is just so exciting. Tell us, so that we're clear, because we're going to talk, I think, in future weeks about funding that's available to, for example, startups outside of a university context. But let's drill down a little bit into your world specifically, Denise. What are the programs that you're bringing into these 15 public universities in the state of Michigan?
Sure. So the first one is the Advanced University Proof of Concept Fund, administered by Michigan State University's Tech Transfer Office, but statewide. Proposals, it provides matching funds for kind of a early proof of concept to see if there's something there. They can work on a project for 6 to 12 months. They get matched up with a mentor at their home institution. If they have them, they have access to a group of mentors that kind of travel statewide. And we really try to engage and get a good understanding of what the technology is, the milestones they're trying to accomplish, and where they go as a next step, and what makes sense for the technology as a next step. The second one is the Mentors in Residence program, and that kind of umbrellas across both the early stage proof of concept as well as the MTRAC program, the Michigan Translational Research and Commercialization program. So the mentors kind of get involved in, getting an early look on the technologies and becoming an active participant in the process. And then the Michigan Translational Research and Commercialization program, the MTRAC program, is kind of the laser focused statewide program on translational research, which just simply means doing things to get that product or that project from the lab into the commercial market. The MTRAC program is a statewide program, supports translational research in universities, hospital systems. So it's our first foray into understanding that hospital systems do bring technology out into the market. They're a great customer, so why not? You kind of have built-in customer discovery. And then we also support nonprofit research centers through the MTRAC program. There are 5 innovation hubs located across the state, and we have 2 at the University of Michigan in advanced transportation and life science. We have 1 at Wayne State for advanced computing. We have 1 at Michigan State for ag bio, and we have 1 at Michigan Tech for advanced materials. And those programs in their own right support technologies from all across Michigan. So we've had Michigan Tech in their advanced materials supporting projects through U of M and Michigan State. So it's a really cohesive area. And the importance in the way that MTRAC is so successful is the oversight committee that provides guidance and overview of all of the proposals. And the oversight committees are made up of industry professionals as well as venture capital professionals, kind of in those key sector focus areas. So it's really meaningful for a technology to get in front of people that have experience in their area of interest in which they want to get their product out to. MTRAC also provides a great opportunity when they're working on a project for a faculty member to engage students. So we have a lot of postdocs, we have research students, we have labs tech students that get involved in this project and working on bringing something to market. And a lot of times it's the postdoc who will actually have that entrepreneurial desire and entrepreneurial spirit and take that technology out into the market. So it's a really cool kind of, little ecosystem we have inside of an ecosystem. We're really excited. MTRAC is very, thoughtful in its approach, and we get great returns, if you will. MTRAC was a gold award winner through the International Economic Development Council. So we were awarded that because of our public-private partnership and the outcomes that we were having from the program. Back in 2016, MTRAC became a statewide program, and since then, the oversight committees have seen 494 proposals, funded over 230 projects that have created 44 startups, 108 jobs, over 50 licenses and options, and then attracted over $180.8 million into Michigan's ecosystem for further work in those labs.
Those are really impressive numbers. And of course, many of us have watched these programs sort of grow and change over the years and mature. One of the things that I've found most impressive, especially getting to see the MTRAC from the inside, is you've got a hub, but that hub is by no means the only recipient of the funds. So for example, the Life Sciences Hub housed out of Innovation Partnerships now at U of M, but funding innovations from all over the state. Anyone can apply from any of the major schools, and they're getting funds out of it. How did that? I guess I should say it this way: was that at all hard to get that kind of a collaboration happening?
It wasn't hard. It took a lot of thought and outreach and conversations and feedback. It started from an idea that I had when I was working with the team at Innovation Partnerships and Fast Forward Medical Innovation. there was a federal grant program called the REACH program, and it was a hub and spoke kind of a program. And as we were looking through it, and the original M-Tracks were kind of coming up on their end of cycle in which we would have to do something. And in the meantime, in running those programs, we had some requests from other universities of, can we get our own M-Track? How do we get involved? So in thinking about that and getting that feedback, and then looking at an example of this federal program, I thought, gosh, I think we could do this with the M-Track program. So it just became an understanding of, okay, what do I have to do inside the MEDC to stand up a statewide program? What does that look like? What are the, check boxes we have to meet to make that happen? And it was also, what does this look like from somebody who would run a hub? What is, are they interested? Would these universities be interested? What does that look like? The number of people we would have. And then also talking to the hospital systems and the smaller universities to say, hey, would you be willing to participate if we had something available? You said you wanted to. What does that look like? What does the application process look like? What does the grant reporting and the contracts, the subawards look like? How do we go about doing that? It took about 6 months to really think through all of that and get feedback from all the partners across the state on what it would look like from both sides of A, administration, and B, participation, and what we would need to stand up. And then, getting that presentation ready for the Michigan Strategic Fund Board, in which we did in April. We presented the idea to the board. We had some money that we seeded it with and got their approval. And the rest is kind of history. Michigan State's Ag Bio was the first innovation hub in June of 2016, and then Life Sciences was right behind it in July of 2016. And we've added them since then. So it was a process. It wasn't hard. It just needed to be thoughtful and making sure that you had the buy-in. It was that customer discovery. You had the buy-in of everybody that might participate. And then it's just a matter of getting them to participate, continuing to communicate what's available, how to get involved. They keep their own IP. This is not an intellectual property play for any one of the hubs. We're all in this together. And, we're just continuing to give that message and to work through it. And, we're really excited as a team to have such great outcomes and win awards and, work together in a collaborative nature.
It's really amazing. It's been so fun to watch that mature and come to where it is. And I'm sure it'll continue to grow and mature as the additional needs become apparent. And I guess maybe even just to pause here, if somebody's watching this, or if somebody stumbles across it and they said, "Oh, a series on early stage funding. I wanna quit my clinical job and I want to go out there and I want to start a startup and I'm not sure if I'm ready to take the big jump." And I think one of the messages today is if you're in the state of Michigan, hold on. There's some nurturing left within that context if you're working for one of the publicly funded research schools, because they want to see these kinds of ideas go out. You don't have to cut and go off completely on your own and take that gigantic risk. There's actually room within those systems to explore these ideas within the strength of those organizations funded by MEDC. So I just think that's so cool. You don't have to jump off the cliff quite yet. You can stay where you are and you can explore those ideas. And if you thought it was just the biggest ones, no, that's not the case at all. Let's go back to the vision for just a second, Denise. Why do you feel, and you've passionately pursued this for years. I've known you in this role for years. Why is this important? Who cares? We've talked a little bit about it, but from a 10,000 foot view, why should we care?
Because it matters. It matters to the state of Michigan. It matters in creating companies that people can get a job at. It matters obviously from the job perspective, as I just mentioned. It matters in bringing money here to Michigan. And it matters in having the universities be at the table in the conversation of economic development. There's just not a single path when you're doing economic development. It's everybody is involved and everybody should take ownership. So why not have our universities come to the table and hold up all of the great things that are going on inside the universities and get that out into the commercial market? And at the end of the day, it also supports us as consumers of those products, whether it be Gatorade. Gatorade was a technology that came out of a university. Flu mist. We have satellites going in the air. That's technology out of a university. I mean, the list can go on and on. Battery technologies, life sciences technologies. We have the patient company that was spun out of Spectrum Innovation that created a product that helps move patients back and forth from the bed to a gurney or something of that nature. So these are real products that are getting out into the market and helping us as consumers of those products. And you have to support that somehow, some way. It just doesn't magically happen. And so with all of that thought process and understanding of what it takes and everybody working together to make it happen, that's why you do it. And that's why it's important. And we continue to do so.
And of course, this is high risk stuff. This is not the kind of thing that necessarily a VC is going to be willing to support at this point. You can't go out and get investment banking for this. You can't do this on multiples of current sales. This is something that requires that kind of vision and saying, yeah, we're going to take a risk together, and it's going to be a reasonable risk, but nevertheless, it is a risk.
Absolutely. It's a risk, but it's also okay to fail. It's okay to pivot. I think of Parabricks always comes to mind when I think of a pivot. They applied to the advanced transportation program a long time ago. And the oversight committee took a look at it and looked at their milestones and looked at their plan. And they said, hey, we think this might be a better fit into the life sciences program because of X, Y, and Z. So they took that feedback, went over, applied to the life sciences program, received funding, and then created a company and was just acquired, I think, in the last year or two by NVIDIA. So, great story that talks a little bit about it's okay to stumble a little bit. It's okay to fail because then out of that comes a different learning. If it's not, it's also to say it's not for me and to step aside and let somebody else come in and help. So lots of opportunities for anyone who's interested.
Yeah, it's very cool. Before we talk about some of the buckets, Denise, about like what goes on and what's available and how does help get given, because it's not all financial resources. There's a lot of other stuff that goes on. What does, I guess, at some level, what does success look like? If an idea moves forward and becomes a startup with licensing out of a university, if they get follow-on funding, how do you measure success after this translational funding stage?
So based on some of the legislation, there are some things that we measure as part of the programs that we support. So we measure jobs, we measure startups, we measure follow-on funding, patents, things of that nature. I think ultimately the altruistic measure of success is a product getting to market and getting used by all of us. But I think along the way, there are many successes, and we shouldn't overlook the many successes. So if the best path to market for a technology is a license to a company as opposed to a startup, that's okay. That is success. If there's something happens along the way that says, hey, I don't know if the market's ready for this. You're kind of doing a solution that's looking for a problem. So why don't we do something else? Why don't we set it aside for a minute? That's okay too, because you don't want to spend a lot of time and use up a lot of resources, a lot of money to have it fail way later in the process when you could have, stopped it early and focused your energy and time on something else. So I think it's important to look for the many successes along the way. And, like you said, we have a lot of resources. It's not just always about the money. It's about the people that can help you. It's the connections, it's the feedback, it's the mentoring, it's the corporate connections for, feedback on what you're actually building. It's the capital connections of someone who might give you money to, keep doing what you want to do. So
I've often
a lot of people and things at play.
Yeah, no, I like your point about actually measuring different metrics and saying here's successes. The one that we're looking for is to get this, get this product or this service to to the end user and have them value it. I've often thought that first in human is a really, really important one that often gets overlooked. If we've taken something that couldn't be reasonably used except at the bench or on animals and we get it to people, to me that's a gigantic step that oftentimes doesn't get enough credit.
Yep, I think so too.
Well, let's talk about the buckets. So obviously funding is the big one. You've got this idea, you want to see it move forward. How do I get funding to move it forward? Guess what? There's funding available within the universities from a MEDC to do this. What other resources come along with that funding?
Well, as we talked a little bit before, mentorship is almost as important as the funding, because you can get the funding, you can work on your milestones, but then what happens? And a lot of faculty members, a lot of clinicians, they are brilliant scientists and do great things at the lab, but don't know how to bridge that gap and get it actually into the market. And there are business people that are great at doing that, but couldn't do the science. So why not have a team approach and match them up with people? And so that's what we try to do through the mentor program, the Tech Transfer Talent Network. So we have mentors all across the state that have great expertise in the physical sciences, life sciences, software, and they get involved and help the faculty figure out how to really get this to market. So I think people are just as important as the funding, and they all kind of go together and they work together. You can't really have one without the other and claim success at the end necessarily.
Yeah, that's a huge point. Oftentimes I've seen in these kinds of advisory committees, oftentimes the advice to an effort is hold on, you're biting off more than you can chew, as though they felt they had to say, here, we're going to do all these great things and make this value to your money. And an experienced advisory team can sometimes say, yeah, we like the idea, we like where you're going, and by the way, you're biting off way more than you're ever going to be able to chew during this phase. Why don't you tame it back, and here's where you're going to really be able to show the success. Or vice versa. That's nice, but it's basically a research project. You're going to need to hit more than that for this to be a worthwhile use of state funds.
Absolutely. And some of that advice is really invaluable. You can't put a dollar amount on it. So it's great for the project teams to get that feedback. And I've also often heard, the project teams that didn't get funded really valued the feedback that they received from the committees. And so they go back to the lab, they really listened, they work on what they need to work on, and they come back the next cycle and they get funded. So they're all the better for being told a no or a not yet. It's not really a no, it's just a not yet. Here's a couple of things you need to do. How about you give me a call in the meantime? I'm happy to provide a little bit of feedback and then come back next time.
So let's say I'm a researcher, I'm a clinician at one of these institutions around the state of Michigan, big or small. And I'm playing with the idea that what I have here is more than basic research. I want to get it out. And I'm maybe even thinking so strongly, like, yeah, maybe I should go start a startup. And the message is, hold on, there are resources here, de-risk it, get through that next phase. What should I be thinking about? I know I'm going to have to make a presentation. I know I'm going to have to make some kind of an application. I'm going to have to, put this in front of a board of people. What should be foremost in my mind if I'm thinking about doing that? What kinds of things am I going to need to have to bring just the raw materials that you're going to tell me how I should put this in a format, and the hubs will tell me how I should put this together. But what's got to be front and center in my mind?
The first thing that you need to do is to talk to your tech transfer office. If the institution doesn't have a formal tech transfer office, they're usually found inside of a VP of research or a research department. There's someone that might handle that kind of thing. We've seen them sit inside of maybe a graduate studies type of a scenario in some of the smaller institutions. Or, feel free to call somebody at MSU or U of M or call me and I can help you find somebody. But you need to understand the technology transfer piece to it, which means intellectual property, which means, should you be talking about it? Should you go to that trade show or should you go to that event and start talking about your stuff before you've done some things to protect yourself before you get it out in the market? So that's one of the things to really understand. A lot of the schools now are familiar with hearing us talk about MTRAC. So they will also be able to say, hey, look, there are some things available to us. So once we nail down that intellectual property piece and what we should be doing and kind of assess out what you've been doing in your lab, understand what's available, let's go talk to a couple of people. Let's just have some conversations, see what we should be doing, what we should be thinking about, get their feedback, and just kind of start to methodically walk through the process to understand where the gotchas are, before you get too far down the pipe.
Gotcha. So yeah, make sure you've got your IP figured out. You're working with your local tech transfer office. Clarify that again, if they don't have one, or are there some schools that don't have formalized tech transfer offices?
There are, but there's usually someone inside the institution that knows what to do, from an intellectual property perspective. So we can help, find that individual. A lot of the bigger institutions are also happy to have a conversation, give you some ideas, and advocate on your behalf to your institution on how to kind of take that next step.
Yeah, that's great. That's wonderful. How about the other kinds of things that folks have heard us talk about on the show when it comes to, successful efforts like customer discovery, understanding your market and stuff like that? Maybe manufacturing, like, I don't yet know how I'm going to manufacture my idea. How much or how little of that do you want an academic researcher to come with? They might be scared saying, oh no, you're talking this up like it's this big commercialization effort. I don't know half of this. But I want to move in that direction. How much of that do you expect them to do ahead of time? How much of that comes along with the mentoring? How much of that will happen in the future? What would you recommend there?
Based on their experience, they might kind of already know that. If they're familiar with working with industry, if they've done some sponsored research projects, which are research that industry sponsors and pays for to have a faculty member solve a problem that they have. So they might already have an understanding of that. If they don't, that's where the mentorship comes in. So before a faculty member or clinician makes a proposal into the program, they have a conversation with someone, we get them in touch with a mentor, and they talk through a lot of that. A lot of things we just require that they have a general understanding and a knowledge of, okay, these are some of the things I need. They don't have to be experts necessarily in the manufacturing side or the customer discovery side, if their, superpower is in the science. We have other people that might be able to assist them in that. But a general understanding, so they know that this is going to be a process and they do need to do some things, but there are people to help them, is usually a good mix.
Yeah, so be thinking about it, but don't worry if you're not a local expert in this. That's what some of the mentoring is for.
Absolutely. And, don't let that preclude you from, submitting to the program to get some funding to support the science.
Yeah, that's very cool. I want to make sure we also get to talk about some of the successes that have come through this program already, because it's been going for a while. Can you give us a few case studies, either obfuscated or not, of some cool successes that have come through?
Sure. I was, as I was prepping for our conversation today, I started to write down some things that come to mind. And, it's pretty phenomenal when you look back, when you take a minute and look back. And I tried to frame it around the MedTech space for your audience today, but there's a plethora of projects that have happened that are supported through, mobility and materials and ag and all kinds of things. But, as I mentioned earlier, we have the patient company that was a spin out from Spectrum. We've had a couple of licenses through BOMA as well. And I think Henry Ford licensed a technology to a startup that they had received funding from MTRAC. We have Fifth Eye. Fifth Eye is a company that's raised a bunch of money. They now have 2 products that have been approved by FDA. We have Genomenon. I like Genomenon because I know Mike Klein. He was a mentor before he spun out with the company. That company's been around for a little bit, just raised their $20 million in Series B, hiring people and doing great work in the genomic sequencing of rare diseases, doing lots of partnerships, lots of great things happening, and they're located here in Michigan. I think about Evoke. They are a vaccine technology. So again, hiring people, raise some money, Parabricks, I mentioned, they are a great company. They hired some people, they were acquired, and they're still continuing to do some work. So Greenmark Biomedical is another one. They do oral health. They've been a spin out for a while. They've been able to be supported by a number of programs and services across the state of Michigan to help them get where they're at. And then finally, recently, we talked about and did a story on Ebu Health. Ebu Health is a company that had come through MTRAC, received mentorship, a lot of resources in the state of Michigan. It was kind of under our guise of it takes a village to raise these startups, and they've been a great one and kind of getting on their way. They do remote patient monitoring and things of that nature. So lots of great examples of companies moving on and doing what they need to do to, continue on and grow here in Michigan.
That's awesome. It's really fun to see this. And it's fun to see, I think one of the things that oftentimes in public facing contexts, people can be too quick to look at something and say, oh, I'm gonna chop that off. I'm gonna do something completely different. What I love is sort of the longevity and the maturation of these kind of programs that are learning, growing, reinvesting in its own internal knowledge of how do we do this and how do we do it well. I have one more question for you, Denise, and that is for all of the, you see so many of these proposals and you sit through and you arrange mentors to come and you arrange funding to come and all these things. It's a lot of work. You've seen so much of it. Sort of if there was one thing that you could tell somebody who was thinking about participating in one of these programs, something you'd wanted them to focus on, so you didn't have to say it again in the meetings, what would it be?
Who's going to care about what you're doing, and who is going to give you money for what you're doing? So again, hint, it goes back to customer discovery. So why should somebody care, and why should I give you money?
Yeah, that's great, because any dollar that's put in now has to be picked up later on by that kind of a part of the flow.
That's right. Yep.
No, that's great. Love it. I'll just let our audience know if you got any questions for Denise, feel free to pop them in the chat. We'll get them to her. Or raise your hand if you got any questions. We're looking forward to continuing this topic all throughout the next month. Early stage funding, different ways to get it. Next week we'll be talking, to Margarita Hernandez from Ann Arbor Spark about some of her on-the-ground experiences of getting funding to just sort of the next stage in startups. You're maybe not even ready for angels. You're maybe not even ready for VC, certainly. But what are some of those options? Denise mentioned some of those today as well, like the BAF funding that MEDC has. What I want to do right before we close, Denise, is I want to bring this subway map back up and just have you, now that we've talked through the early stage funding, if we can bring the subway map back up full screen there. We've talked through a lot of this part in green over here today. We've talked about the mentors that are available. We've talked about some of the funding that's available. As we look forward here, and this sort of goes into the rest of the series, you mentioned at the outset some of these kinds of resources that are available. So now that we've talked about translational research and translational funding, take us back to this blue part and just give us a really, really quick re-overview. As we now, in coming weeks, we'll be thinking about either state or regional grant funding that's available, or we'll be thinking in future weeks about angel funding, or we'll be thinking probably in the month of August about venture capital funding. Tell us just a bit more about what other things are being funded by MEDC. Where does that dovetail continue to happen? So just to recap some of this blue.
Sure. So we talked a little bit about the three-legged stool. So that the first leg is university programs. So we've talked about that. The second leg would be service providers. So you see here the smart zones. We support the Gateway program with the smart zones. We support the SBDC tech team. We support BBC ETC, which is a biotech training company that helps with SBIRs and STTRs. They have DoD expertise, so you can get plugged into them as well. They're in Ann Arbor. And then we have the third leg of the stool as early stage funding. So that is the Emerging Technologies Fund, which is matching to the SBIR, STTR. We have the Business Accelerator Fund, we have the First Capital Fund, and the Pre-Seed Fund. So you have university work, service providers, and then early stage funding. So if you're not a university spin out, but you do have a cool tech idea, get engaged with your local smart zone, and then they can plug you into all of the items that are listed, in the blue zone, if you will.
So not to worry if you're not a university researcher. This is just starting that whole process off. But if you're not, there's options, and the smart zones exist in all the major cities, I guess I would say, and they're distributed regionally.
Absolutely. And there's a smart zone map with connections and information on how to engage at michiganbusiness.org/entrepreneurship.
michiganbusiness.org/entrepreneurship. We love it. Well, that's awesome. Well, I'm not seeing any questions here today. Denise, why don't we let you have the last word as we close out the first session on early stage funding. What's on your mind? What should be on our minds? And where do we go from here?
So thinking about early stage funding, be thoughtful about it. Understand what your milestones are at each stage of the level of funding. If you get through and you do have the opportunity to seek venture capital funding or angel funding, make sure you're targeting the right company, the right individuals that can support you. Stay focused in that so that you're not spinning your wheels and spending a lot of time, because it does take a while to, find the right partner when it comes to funding. So be methodical, be thoughtful, and laser focused on what your needs are and when you need them.
I love it. Denise Graves, University Relations Director, MEDC. Denise, thanks for being with us today.
My pleasure, Gene. Thank you. It's always fun to chat with you.
Always fun. We'll see you back for Women Who Innovate coming up.
That's right. Thank you.
Well, and with that, I want to thank you for being with us for MedTech Crossroads today, this Friday. And every Friday, we will look forward to seeing you next week. I'll have Margarita Hernandez and Brandon Martin talking about the actual on-the-ground experience of just outside the university. We're talking about early stage funding for local companies that are out there doing their thing and scraping to get by. So we will talk about that next week. After that, angel funding, and we'll move on from there. Thanks for being with us today. We'll see you next week.